Hi everybody, I'm Chris Prang, the Medicare analyst, and thank you for joining me for this Medicare News Update Webinar. My goal is simple. It is to help you make a wise and confident decision about all of your Medicare choices, not just some of your Medicare choices, so that you can protect your income, your assets, your savings, and your health. It is truly all about maximizing your Medicare. I am based out of Charlottesville, Virginia, but as you can see, I am licensed in numerous other states as well. So if you happen to live in one of those green states and you would like my help when it comes to Medicare and you don't already work with another good agent, then by all means, please reach out to me. If you are from one of the blue states, then I just ask a favor. Put the name of the state in the comment section below, because it does sometimes help me determine whether I want to get licensed in any other states. On the agenda for this webinar, first, again, I am very glad that you are here, and if today happens to be your birthday, then a very happy birthday to you. So we're going to talk about Medicare supplement rates that are trending up. We're going to do a 2025 crystal ball when it comes to the Social Security cost of living adjustment, the Medicare Part B premiums and deductibles that are going up, the Inflation Reduction Act and how it's going to affect your Part D drug plan for 2025. You want to pay attention to that. And Medicare Advantage headwinds. So if you have a Medicare Advantage plan or you are considering one, this is critical. Delays in getting care, and why in the world don't you have an estate plan? So recently I did a video, my second quarter Medicare supplement rate update, where I said the trend of higher rate actions will continue. What are your options? So if you have Medicare supplement and you've not seen that video, you may want to check that out. CSG Actuarial states, the 2023 Medicare supplement overall market loss ratio spiked to 83.8%. The higher that is, the less money the insurance company makes, as premium levels struggled to keep up with increases in post-COVID claim utilization rates. So why are the rates on Medicare supplements going up faster? As mentioned, increased utilization. What that simply means is more people are utilizing their benefits because they are going to providers more now since COVID, and they're taking care of elective surgery, whatever it may be that they need. So that has gone up. Healthcare inflation goes up every year. Many times it outpaces regular inflation. And then, of course, every single year, increased Part A and Part B deductibles and copayments that the Medicare supplement companies have to cover. Telos Actuarial. We expect the trend of higher rate actions will continue throughout 2024 as claims come in higher than previous years and push up loss ratios. Take a look at the picture right here. Average Medigap Medicare supplement is the same thing, rate increases going back to 2021 all the way to 2024. You see that 2024 is higher than all the previous years on the Plan F, the G, and the N. So the rates are going up. What you don't see on there is a high deductible G, and if I had a guess, that percentage would be much less than any of those. High deductible G is a great option for people that are healthy and maintain their health, especially if you're from New York, Florida, and some other states. The Society of Actuaries, in their issue brief, Changing Financial Risk for Medigap Insurance, they have a whole list of why rates are going up. Number one, as mentioned, COVID. People have deferred certain types of care during COVID. Now they're coming out of the woodwork and they are getting care. Increased Medicare deductibles and copayments, as I've already mentioned. And as I've already mentioned, general health care inflation as well. Number four, gene and cell therapy. More approved costly therapies that Medicare supplements need to cover. These therapies typically fall under what's called your Part B medications, shots and infusions. And as these things develop, they are very expensive. And if FDA approves them and Medicare then will typically cover them, that means the Medicare supplement company has to cover them as well. And they can run into the thousands of dollars. Here's an example of one. Leqembi. It is an Alzheimer's drug. It has had some pretty good success so far for some people. And it costs thousands of dollars. And so if you have Medicare, Medicare is going to pay 80%. But now the Medicare supplement company's got to pay 20%. And that 20% can start running into hundreds and hundreds of thousands of dollars every year that the Medicare supplement company has to cover. Number five, the aging baby boomer population. Medical costs increase with age. The older you get, the more likely something's going to happen. You're going to develop Alzheimer's or some sort of chronic condition. Hopefully not, but the odds are that something will happen as you get older. And then more states are mandating what are called guaranteed issue rights, meaning regardless of past or present health conditions, you can get a Medicare supplement, as unlike the state of New York, guaranteed at any single time. And so what happens with that is you have less carriers that are willing to sell it there, and they got to cover everybody regardless of health. Take a look at this. Medical care prices have generally grown faster than overall consumer prices. Going all the way back to 2000, all goods and services, the CPIU, U for urban, has gone up 85%, whereas medical care has gone up 119.2%. So next on the agenda, delays in getting medical care and treatment. So there are staff shortages. Doctors, nurses, and other healthcare providers have left work. They've either retired or during COVID, they got fed up and they were out of there. So we have less people in the healthcare industry to take care of more people that need it, especially with an aging baby boomer population. Again, I already mentioned increased utilization due to people coming out of the woodwork for post-COVID. So now you may have less doctors, but we have more people needing care. This is driving up the delays that are taking place. I have heard of people taking literally months to get a doctor's appointment, even for something important. I can think of somebody right now that has developed cancer, and it has taken weeks, if not months, to even get a protocol, let alone treatment. Prior approval delays. This is across the board, doesn't matter. Major medical, Medicare Advantage, and the VA. Sometimes you get a prior approval, and that could take a while before it gets approved, and so that can delay care. Sometimes it could be minutes, hours, and sometimes it's days, maybe even weeks before you get the approval to get the care. So delays in getting medical care and treatment are becoming an issue. All right, the 2025 crystal ball. Social Security 2025 cost of living adjustment estimate is currently going to be 3.2% higher than what you got last year. But there's give and take. So you get more in Social Security, then you got to pay more for your Medicare. So 2025 Medicare premiums and deductibles from the Medicare Trustees Report. The Part A deductible will go from $1,632 to $1,684. The Part A co-payments are going to go from $400 to $421 from days 61 to 90, and $816 to $842 for your lifetime reserve days, which you get 60 of. The Part B premium increases 5.9%. So you got 3.2% in your cost of living adjustment, but you got to pay 5.9% more in your Part B premium from $174.70 to $185. And then your Part B deductible goes from $240 to $257. From the Medicare Trustees Report, the hospital insurance, cost sharing, and premium amounts, you can actually see the history and what the projected premiums and deductibles will be. So for 2025, you look in the red box, $1,684, and you can go all the way out to $233. You can go all the way out to 2033, and you can see what they project to be the deductibles and the co-payments and even premiums for Part A. Not guaranteed that's what it's going to be, but that is their projection. When it comes to the Part B side, you can see, again, for 2025, it's going to be $185, and the deductible will be $257, and you can follow that all the way out on there. You also see the Part D, what they call the base premium. Premium, basically what that is to determine if you have a late enrollment penalty, they base it off of that 1% of that amount every single month that you have not had it. And then you see the catastrophic threshold where it was $8,000, now it's down to $2,000. That should save some people some money. And then the incurred per beneficiary costs, how much have they changed recently? Look at 2021 to 2023 in the red box. How much under Part B that those have increased? 9.5%, 4.6%, and 6.9%, and projected to be a little bit less in 2024 and 2025. When these things go up, when more people are utilizing it and it costs more to do, again, Medicare Supplement companies got to make up for that. All right, the Inflation Reduction Act and the Part D changes. So the out-of-pocket, as already mentioned, is now going to be capped at $2,000. This will save many people a lot of money, but it's got to be made up somewhere with plans having more deductibles, higher co-payments, whatever it may be, covering drugs differently, whatever may happen. The coverage gap in the donut hole will now be eliminated. If you're not familiar with that, what would happen is once you exceeded what they call your initial coverage limit, you hit the coverage gap. And then you had to typically pay a higher price for the cost of your drugs until you got out of the coverage gap. That will now be eliminated altogether. You want to pay attention to your annual notice of change, what we call your ANOC. It usually comes in September to early October. It can look like junk mail. So pay attention to even your junk mail come September. So if you have a Part D plan or a Medicare Advantage plan, what it's going to tell you, usually going to have a chart on there, and it's going to tell you on the left side, here's 2024 premiums, deductibles, co-payments, and here's 2025. You want to pay attention to that. Is there a radical change? Now, if you are on inexpensive generic drugs, or you don't take any medications at all, and you don't see a radical change, especially in the premium, then you are typically perfectly fine to roll right on over to 2025 and not even worry about it. But if you are taking tier 3 and higher medications, specialty drugs, more expensive medications, then you're going to want to check in the fall to make sure that you have the lowest overall cost drug plan for 2025, because they can change from year to year. You could be on a great plan now, but next year it could be a not so great plan. So if you don't work with an agent and you're from one of the states I'm licensed in and you want help with that, come October, reach out to me. All right, Medicare Advantage headwinds, and there are definitely some headwinds coming against Medicare Advantage. Again, increased utilization that wasn't predicted or planned for. So just like the Medicare Supplement companies, they kind of missed this thing happening. And so all of a sudden they're getting dinged for claims that they were not projecting. Therefore, that's going to affect the future and what they do with Medicare Advantage. The Medicare Advantage capitation rate is going to increase 3.7%, or over $16 billion more going to Medicare Advantage. Last year was 3.32%. The 10-year average is 2.87%. But the Medicare Advantage carriers are saying that is not enough money due to the increased utilization. So what is the capitation rate, in case you don't know? So all these Medicare Advantage plans are all subsidized or funded by CMS Congress. And how much funding a Medicare Advantage plan gets is determined mostly by the demographic area you live in. That's why when you see the commercials, we need to know what your zip code is, because every zip code gets a different amount of money. And that's why you will see a plan in one town and not a plan in another town or county. You could live on a county line and your neighbor across the street could have a better plan, or you could have a better plan just by being in a different county. So that's primarily how the Medicare Advantage companies get their money. They can also get more money by how well they handle the plan, getting you to do your preventative services, and the star ratings. And speaking of star ratings, there are changes coming. So plans are assessed, if plans are assessed lower ratings, then their reimbursement rates will be less. And there is pressure from the government and outside sources when it comes to prior approvals and benefit denial. So there's been a lot of talk in Congress, in the Senate, about Medicare Advantage companies denying coverage for people, whether it's for a procedure, for a medication, skilled nursing, whatever it may be. There's been a lot of talk about that, and the government is now saying, hey, we cover it on Medicare, you guys need to cover it. And it's always been that way. The difference is with the managed care, they could say, nah, you don't really need that. And there are times, okay, when having a prior approval is important, and you may not need the procedure. So there is a purpose to prior approvals, and it is not just to save the insurance company money, but it is also to potentially help you and even save you money if you happen to have a copayment that goes along with that. And I may address that in a future video as well. So usually what you hear about prior approvals, they're all bad, and Medicare Advantage and everything like that. But there is a actually good purpose to prior approvals as well. But if the Medicare Advantage companies now have to approve more things than they would have before, then that means that's going to affect their bottom line. Take a look at these headlines here from the Center for Medicare Advocacy. Medicare Advantage industry will focus on profits over benefits. So better for them, not for you. The Medicare bubble has burst. Government health insurance program had been a gold mine for private insurers until recently. Medicare Advantage unrest, change healthcare fallout, and more big takeaways from insurers. All major payers saw elevated utilization, but only an unprepared few struggled with the trend. So this is from statnews.com. Over the last several years, health insurers have prioritized growing their Medicare Advantage membership rolls, often by advertising zero premiums, dental, vision, and other new supplemental benefits like my grocery card, even if it has meant lower short-term profits. That strategy backfired, most notably for Humana and now CVS, which is also Aetna. So what does this mean for you? You may not care about the Medicare Advantage company, but you might want to care about yourself. So what does this mean for you if you have Medicare Advantage or you are considering? Here's what it means. The likelihood of increased premiums and or less benefits. So if you're on a zero premium plan now, you may see that you have a premium next year or you have less benefits or both. If you're in a plan right now that has a $50 premium, you may see that jump up to $75 a month. If you have dental, vision, and hearing coverage, you may see those lowered. Maybe you got $2,000 a year worth of dental, which is great. You may see it drop to $1,000. The wonderful Part B give back, and what that basically means is the Medicare Advantage company is going to cover all or part of your Part B premium. You could see those go away or be reduced. The wonderful grocery cards that they love to advertise. Those could be gotten rid of altogether, or instead of getting maybe $50 a month for your groceries and utility bills, you may get $25 per month. So you should expect to see some of those go down. So again, you want to pay attention to your annual notice of change coming in September to early October. And then higher maximum out of pocket is what we call a MOOP, maximum out of pocket. So the higher the maximum out of pocket, the more money you are on the hook for. So I project that those are going to be higher on some plans. Now, my personal advice to people in most cases is find a plan with the lowest maximum out of pocket. Reduce your financial risk exposure. The extra benefits are nice. I don't believe you should choose a plan because you get so much in extra benefits. I believe you should choose a plan that you can access the most doctors in the easiest way possible with the least amount of money that you are on the hook for. It is not about grocery cards and all the extra benefits that they love to advertise. So pay attention to your annual notice of change. All right, last thing on the agenda, do you have an estate plan? Let's look at some of these things. So first, you should have a will. A will is a legal document that describes how you would like your property and other assets to be distributed after your death. The good news is 76% of people 65 and over have a will. If you are one of the 24%, I would love to see you by the end of this year, by the end of summer even, to go and get yourself a will. Talk to your spouse, talk to family members, find a good estate, elder care attorney that can handle that for you. Next, a living will is a legal document that details how you prefer to receive medical treatment when you can no longer make decisions for yourself. Like, do not resuscitate if I'm in the hospital. You just want to pass and pass peacefully. Good news, 72% of those 65 and over have a living will. And usually what happens is when you get a will, you usually, for a little bit more money, you go ahead and get a living will. And that's why those percentages are so close together. Power of attorney is legal authorization for a designated person or persons, yes, you can have more than one power of attorney, to make decisions about another person's property, finances, or medical care. That means you need to trust that person with your life and your money. 58% of baby boomers have a power of attorney. So that means 42% don't. And I can't tell you how many times over the years that I have run into seniors and people on Medicare that do not have a power of attorney. And what happens is when it's time for their adult children to start making decisions, it gets very difficult to do. My advice, get a power of attorney as long as you have someone that you care about and that you trust to make decisions in your best interest. Maybe a trust. A trust is a fiduciary or faithful arrangement, allows a third party or trustee to hold assets on behalf of a beneficiary or beneficiaries. 18% of those 65 and over do have a trust. Usually people that are more affluent do have a trust, but that doesn't mean that you shouldn't have one if you're not affluent or consider yourself affluent. The advantage of a trust is it avoids probate, meaning going through the court to decide who gets what and how things are divvied up. It is more private. You have potential tax benefits, you or whoever's getting the funds or the property. and it is more customizable than a will. And then long-term care and Medicaid planning. So outside of healthcare costs, once you are a senior or you're 65 and up and you are on Medicare, you're going to have Medicare premiums potentially on your supplements, your drug plans, your Medicare Advantage, and then potentially co-payments and out-of-pocket. Okay, outside of those healthcare costs, which on average for people that are 65 and over the lifetime is like over $200,000. The need for long-term care, whether it's in your home or in a nursing home, is the greatest financial risk that seniors will face. The bad news is 14% of those 65 and over have a long-term care policy, and 7.6% of those 65 and over are on Medicaid or Medicare, meaning there's about 80%, almost 80% of people that do not have a long-term care or Medicaid plan going forward. So if you don't qualify for Medicaid, then you may want to consider a long-term care plan. Now, part of that may be really simple. You have the assets and you have some money set aside that you are going to fund in the event that you need long-term care, whether it's in your home where you hire a health aide to come and be with you part-time or even full-time, or to go into a nursing home. Or you purchase long-term care insurance is what you would do. And there's two ways that you can do that. You can buy a traditional plan, which aren't so popular these days, where you typically pay thousands of dollars every single year for a premium in the hopes that you never need it. And then when you pass, if it's never been used, the money is gone. Okay, like regular insurance. Or you can get what's called a hybrid long-term care plan, which is either a life insurance policy or an annuity. So you buy a life insurance policy, you invest money into it, even if it's a modest amount, to buy you some modest long-term care. And what that does, if you need the long-term care, the money is there. If you don't need the long-term care, then when you pass, the good news is somebody you love, a beneficiary, gets the life insurance benefit from that. All right, the Federal Reserve data shows that 65 to 74-year-olds have a median of $164,000 in their retirement accounts, while those 75 and older have only $83,000 saved for retirement. That is too much to qualify for Medicaid, and it is not enough to cover your long-term care needs should they arise. So that's why you want to do your long-term care and your Medicaid planning. What else in an estate plan? Life insurance. It can be used to cover final expenses, debts, again, long-term care, or an inheritance. 57% of those 65 and over has some form of life insurance. Final expenses are typically like the ads you see on TV for $1 a day. You can get $5,000 worth of final expenses, guaranteed. Be careful with those, okay? Because sometimes it's not such a good deal to get those. But those are marketed to a lot of people that are 65 and up. But maybe that's what you need, and maybe that's the only thing that you can get, and that is the best thing for you to do. You might be able to buy a traditional life insurance policy, but ideally, hopefully by the time you're 65, you don't have the need for it unless it's a special circumstance, like long-term care, to pay off debts in the future, use the insurance to pay off the debt instead of your assets, so to speak, or to give an inheritance. And it is not uncommon sometimes for your adult children to take out a life insurance policy on you so that they have some sort of inheritance from you that way. A last days plan, what is that? That is your funeral, your burial, cemetery, or prepaid funeral. According to a survey by the Funeral and Memorial Information Council, while 69% of American adults want to arrange their own funerals, only 17% have put plans in place. And the older you get, the more likelihood you are going to need a plan. So consider a plan for your last days. Do you want to be buried? Do you want to be cremated? Where do you want to be buried? Where do you want to be cremated? What do you want your funeral to look like? Do you want a lot of money spent on it? Do you want no money spent on it? You could consider instead of a final expense life insurance policy, you could get a prepaid funeral, which is pretty much the same thing, but it may actually save you money. You go to your local funeral home and say, "Hey, I want to be buried. I want to be buried in this cemetery. I want this type of funeral. What's this going to cost me?" And they'll tell you what that is, and you can pay them ahead of time and sometimes overtime. And then when you die, it's all ready to go. So think about your last day's plan. I'll give you a little bit of story about my aunt. She had everything planned out. After she retired, she moved out of her apartment and she moved into a independent living facility where she was independent for many, many years. And then as she had some issues with falling, she moved into assisted living where she stayed for several years. And then after some more issues, she moved into full-time care, and then she eventually passed away there. When she passed away, everything was in order, okay? The funeral home was called. They took her. Her desire was to be cremated. They cremated. They gave the ashes to her attorney. Me and my family and the attorney went to the cemetery where she already had a burial plot that was alongside of my grandparents, and the ashes were taken care of there. It was very simple. Everything was arranged. I had nothing to worry about whatsoever. So what do you want to do? You want to find a good elder law or elder care attorney, not just for your state documents, but for Medicaid planning should you need it. And Medicaid planning is not just for poor people. Affluent people can use Medicaid planning as well, or people that are kind of like in the middle between poor and being affluent, which is most of us. Medicaid planning can be very important because you can preserve your assets to give as inheritance as opposed to spending it down or giving it to the state. And Social Security planning as well. So that is the Medicare News Update webinar. Thank you so much for watching. I'm really glad that you joined in. It's the first time I've done this. If you like what this is, if you found it helpful, by all means, please give it a like. You can subscribe to my channel to stay up to date about maximizing your Medicare. And of course, if you know anybody that can benefit, please consider sharing it with them. When you need help with your Medicare, if you don't have a good agent that you're already working with and you're from one of the states that I'm licensed in, by all means, please reach out to me and let me see how I can help. You see my contact information on there. You go to my website, fill out one of the contact forms. You can email me there, or you can give me a call. That is it for today. I hope that you enjoyed it. I'm Chris Prang, the Medicare Analyst. Make it a really great day.